Everything might not be fun.
Yeah, the politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense?
We'll figure it out. This is the thing. I'm just getting totally unhinged now, and I don't know what to do. So it's a snowy day here in Maryland, and I just wanted to talk to you a little bit about cholesterol, because cholesterol is a big topic. I talk a lot about it, and it's something that people are really interested in. I've talked about it here before, but there's always a lot of good information about it. So I was giving a talk recently. I gave a talk on dementia, and I talked about that we have a lot of evidence that a good diet is really important to dementia. And what's a good diet? So a good diet is basically two things. Eat a lot of fruits and vegetables, and don't eat a lot of sugars and white flour products, what we call processed flour. That's it. We always hear about the Mediterranean diet and the keto diet, but really the bottom line is lots of fruits and vegetables, not a lot of the sugar and starches. High grain stuff is really good. And we know that helps dementia incredibly. It even helps prevent dementia. We also know it helps heart disease incredibly. Helps people feel better, helps prevent cancer, it helps your immune system, helps your gut bacteria. Actually lose weight if you eat that kind of diet. There's a lot of reasons for that. You could eat a high-fat, high-protein diet with lots of fruits and vegetables with X amount of calories, and you lose more weight than you have fewer calories with a high-carbohydrate diet. And by carbohydrates, I mean simple carbohydrates, sugars and white flour, the stuff we like. So why is that? It's because when you eat that sugary stuff, it raises your insulin level really high, and you put all the stuff in fat. And also it gets absorbed really quickly. The other stuff goes through your gut slowly, gets absorbed slowly. It even gets absorbed and eaten by your gut bacteria. So they get the calories, not you. So even though the food has a lot of calories, you're only getting some of them. So the reason I bring this up is the cholesterol controversy continues. There was a recent article by a woman from the West Coast. She's a cardiologist, and she was talking about how cardiologists are obsessed with medicines. All they want to do is put people on statins. She said she received a booklet from the American Cardiology Association about how to treat people with cholesterol. It was 40 pages long. Only one paragraph talked about nutrition. The rest of it was about how to maximally give people these drugs. The drugs really have a very small impact compared to the diet. The diet and exercise help everything. Every possible ailment you have can be fixed if you eat well. And again, it's not that complicated. I gave you the diet. The cardiologist also said that she and her colleagues are graded by Medicare if they give people statin cholesterol medicines, but are not given good grades if they talk to them about diet or treat them with diet. They fail. Unless they're on statins, they fail. That's true to me too. If I have someone who's had a heart attack, and even if they're 90 years old, if they're not in a statin cholesterol medicine, I get a failing grade. Even if I've totally altered their lifestyle and diet, and have them exercise and eating well. It's a flaw in our medical system that we have to fix. So I tell my patients when I talk to them, there's so much within us that we could do to help ourselves that we shouldn't be looking to doctors. In the case of dementia, we've talked about how we use drugs that are worthless. I actually, in my own brain, decide whether a doctor has any ability to read the literature and understand the practice of medicine as to whether they put people on dementia drugs. Because these drugs, we know, don't work. They absolutely don't work. Well, they work the same as placebo. They may work worse than placebo. Whereas if that doctor instead talked to the patient about diet and exercise, two things we know help slow the progression of dementia or prevent it, that makes more sense. But they all put them on the drugs. So my view of humanity has decreased incredibly, especially in my poor profession. I was talking to a psychologist recently about our mutual frustration about dealing with neurologists and other specialists who put all our patients with dementia on these terrible drugs instead of working on other ways to help them. And neither of us knew how to deal with this other than to tell the patients the truth and hope they believe us. So again, cholesterol, people are obsessed with it. It doesn't matter how much cholesterol is in your blood. Measuring cholesterol is not very useful. It's how much sticks to your blood vessels. Makes sense, right? And that diet that I talked about that keeps our insulin levels low, lots of fruits and vegetables, not a lot of processed food, that's how you fix it. So again, it's the same message, but Medicare is trying to tell us do otherwise, and the medical community is trying to tell you to do otherwise. And it's really simple, and it's in your hands. Okay.
Hey, hope you like the podcast. We'll be back next week. I'm going to give you some information. If you want to check the website, if you want to email me, if you got your own stories, let's talk about it. See you next week.